It's 5:30, it's 6 o'clock. What are we gonna have for dinner? I don't wanna make dinner, I'm tired. What do you want for dinner? I don't wanna make dinner, I'm tired too. Let's just order food, right? Let's just order food, have it come into the house, we'll eat, we'll get the kids cleaned up, and we'll go to bed. And we'll just hit restart in the morning. I'm sure you guys have heard that story many, many times. So this is kind of twofold, right? We don't have enough energy, and our diet probably isn't really helping our energy. So I want to give you a few pointers on what you can do to try to help your diet to thus help your energy. Now, one of the first things that we can do in terms of our diet is we can simply try to remove the sugars and the caffeine. Nobody wants to hear that, I know, because we're thinking that's what we need to get us through the day. But I can't tell you how many patients start their day via the Starbucks, going through the drive-through, and what are they going to do? They're going to pick up their caffeine, they're going to pick up their sugar. They're going to get their little morning, their morning buzz there. And I understand that because you're tired, you're on your way to work. Who has time for breakfast? Which is, is totally understandable. But I just kind of want to bring that up because it's such an important thing. When you consume that sugar and it gets into your blood, it's going to cause your insulin levels to go up. When your insulin levels go up, you're going to feel fatigue afterwards. So you're kind of stuck in this a little bit of a hamster wheel, right? Where you're trying to get that energy, so you're going to consume sugar and caffeine, but later on, it's going to make you feel tired. Now, another thing to remember is that whenever you're having high sugar, high carbohydrates types of foods to give you more energy, not only is it going to increase your insulin, but when your insulin goes up, it's also going to cause weight gain. Insulin is a signal not only to lower your blood sugar, but to store energy, and that stored energy, aka fat. So when you're going through this cycle a few times a day, you're probably actually gaining weight. And you may have noticed that. People who consume a lot of soda drinks, a lot of sugary drinks, and caffeine drinks that tend to used to have sugar accompany it, over the course of time, they're going to gain weight. They usually gain on an average of about 10 pounds a year. Multiply that by 5 years, you just gained 50 pounds. And I know that you've seen it because we see it all the time in our clinic. So it's definitely something to think about in terms of your diet, is how do I eliminate sugars and how do I eliminate caffeines from my diet? Now, if we're going to be doing that, we're going to have to eat something else, right? Well, always what I'm going to recommend is nutrient-dense foods. I try to leave that a little bit vague because everybody's diet is different and everybody's going to want to be consuming different things. But keep this in mind, whole food. Is it food? Is it minimally processed? You want things that are actually whole foods. Things that go through, any kind of food that goes through a processing type system, where the food is ground down, it is processed, it is isolated to create some wonderful, colorful product that looks very enticing, usually it does not have a lot of nutrients in it. Where the food that is less processed is going to be more nutrient dense. Now, from the more nutrient dense foods, not only are you going to get vitamins and minerals, but you're going to get carbohydrates in a more, what we call complex form. So these complex carbohydrates are going to be harder for your body to digest. Thus, it's going to take a little bit of time for you to pull the sugars from those foods, and your blood sugar levels are not going to spike. Your insulin levels do not spike, so then you don't feel tired, and your insulin levels do not spike, so then you're not gaining a bunch of weight. Now, being able to get those foods in your diet, it always requires a little bit of work, but it's definitely well worth it. Making these changes, start off slow. Start off with just one meal a day that you decide, hey, we're not going to have a bunch of carbohydrates and sugars with this meal. We're going to have whole food. Make it breakfast, make it dinner, make it lunch. Find out what works best for you. Find out what works best for your family. Just start with that one simple tip, and it can really make a difference. Now, there's other things that can contribute to your energy levels, such as hormones, can also affect your energy levels and sleep cycles. So check out our other videos that we have here about your energy and your hormones, energy, and your sleep. I hope this helps provide you with a little bit of a guidance. Again, you should always go to your doctors, check out some of this information with your doctor, see if it makes sense for you and him. Get your blood tested and see where you stand. If you have any questions, contact our clinic or subscribe to our videos below. We're more than happy to help you out and help guide you. Thanks again.